Now, the Dr. Harry Fisch Program, a show exclusively for men's health issues, where no topic related to men's health is off limits. The Dr. Harry Fisch Program is here to keep you operating at peak performance. From the boardroom to the bedroom and everywhere in between.
The doctor will see you now.
Here's Dr. Harry Fisch.
Hey, welcome back to the Dr. Harry Fisch Show. We got a great show for you today. Our second hour, we have Dr. Adam Schaffner, who is a plastic surgeon. We're going to have him on the air in just a little bit. We do want to talk about, why men are getting plastic surgery, but Dr. Schaffner is one of the experts in New York City on all sorts of reconstructive surgery, on men and women. But we want to talk to him about men. Dr. Schaffner, are you there?
With you.
Hey, Dr. Schaffner, how you doing?
I'm doing well, thanks. How are you?
Hey, thank you. Listen, where can, before we start, how can people listening get a hold of you if they need to get a hold of you?
They can feel free to either refer to my website, which is www.drschaffner, that's DRSCHAFFNER.com, or simply by calling 212-688-6600.
So if I want to have like some Botox or something, I just call you there?
Absolutely.
Hey, by the way, talk about Botox. Is Botox the number one thing you're doing in the office now?
It's certainly one of the most common minimally invasive procedures that we do in the office, and it's very effective in helping to treat fine lines and wrinkles in the face.
In the face, so not in the scrotum. You certainly don't want to put it in the scrotum.
Generally not, no.
It could get the wrinkles out, though, right?
I guess anything is possible.
So tell me, Adam, one of the things that we're seeing a lot more is men getting plastic surgery. What are they going for? What's going on with that?
Well, certainly male plastic surgery is increasing in popularity each year. Currently, it's approximately 10% of all plastic surgery procedures performed. And
10%? Wow.
10%, yes. So while certainly females are getting more plastic surgery than males, men are certainly more interested in getting it each year for personal and professional reasons. And as far as the most common procedures that are being performed from a surgical perspective, rhinoplasty, which is a nose job, eyelid surgery, otherwise known as blepharoplasty, liposuction, especially lipoetching to try to mimic the six-pack in the abdomen, breast reduction to address gynecomastia or man boobs, as they're otherwise known, and even hair transplantation.
Whoa. By the way, I got to tell you something. I don't have a six-pack. You know what I got?
What do you have?
I got a keg.
Well, together we can work on that.
All right. So wait, let me go. So what is the number one thing that men are going for right now?
Nose reshaping, rhinoplasty.
Nose reshaping, really?
Yes, absolutely.
Wow, I would not have thought that.
Yeah, so over 60,000 rhinoplasties were performed on men last year in the United States.
Is it mainly younger men, or what kind of age? All ages?
All ages, absolutely. So you have some.
I would not have thought that.
Yeah, so people, either whether it's to address a bump, the width of their nose, maybe it's the fact that they had some trauma when they were younger, when they were playing sports, and they want to go ahead and get that addressed. So a variety of reasons that people want their nose reshaped.
Is it expensive to do rhinoplasty?
It is not an inexpensive procedure. Sometimes there are reasons for performing a reconstructive rhinoplasty or reconstructive nose job, and sometimes there are problems with the nasal airway itself. And if that is the case, sometimes it's both an aesthetic procedure, a cosmetic procedure, and a reconstructive procedure, so insurance may help for a portion of that.
Wow, it's good, because we have a producer here that's got a nose of it's like an anteater, this guy. So I'm thinking maybe we could send him to you.
I'd be more than happy to help.
Hey, let me ask you this. The economy, okay? The economy is pretty bad. So are you seeing more or less plastic surgery?
Well, the economy, I think, has started to take a turn for the better, and we'll keep our fingers crossed that we continue to see some degree of improvement. But
so you got hit hard with the economy for plastic surgeons? I know I operate. And where do you operate, by the way?
Lenox Hill Hospital, Manhattan Eye, Ear and Throat Hospital, and so are now Institute part of Lenox Hill Hospital, and those are the primary places where we'll perform reconstructive and some of the aesthetic procedures, and then we also have an accredited operating room in our office where we perform the majority of our aesthetics.
Fantastic. So when the economy is bad, you guys took a hit? It's funny because you think that if the economy is bad, sometimes people will try to do everything they can to look better to get a job.
Well, that's exactly right. And so while certainly I think the majority of plastic surgeons in this country did see somewhat of a decrease in 2008, 2009, in various their surgical procedures. In the minimally and non-invasive procedures, there was actually an increase, and I think exactly for the reasons that you state, people want to look better. They want to look as young as they feel on the inside to reflect the energy that they have, so that it helps them both in the workplace as well as professionally. So people are really making an investment in themselves when they're going ahead and performing these procedures. But as you also note, that with the economy taking a little turn for the worse during those years, it's an expensive procedure to have, and so when you're talking about recovery, that's time away from work, people are afraid that might adversely impact them from a professional perspective, and so a lot of people have gone ahead and said, I'm going to take a year or two to wait to have that major procedure and do little things in the interim.
Yeah, well, tell me about those little things. That's important. Like, a lot of people may not have a lot of money. What's the biggest bang for your buck in plastic surgery for men?
It really depends on what their problem is that they're trying to address. So if it's a fine line or wrinkle, they may consider something like Botox. They may want to consider something like a filler if it's a fine line that is there all the time and not just there when they move their face.
Or filler, I got it.
So you might have heard of things like Restone or Juvederm.
Gotcha. All right, so we discussed a nose job. We've discussed so that's the number one sort of plastic surgery that men are getting.
Yes.
What's number 2 and number 3 in terms of the frequency?
Number 2 is eyelid surgery, otherwise known as blepharoplasty, and that can address the crepey, fine skin from the upper eyelid that can sometimes hang down over the
I'm
eyelashes.
looking at. I have that. That's terrible. I look like I'm. My God, I'm like, what's going on over here?
Well, it's something that happens as all of us age, including.
What do you mean age? What do you mean age? Are you trying to tell me I'm aging?
No, I think that we all age. Every single second we're aging.
Not me.
Well, you're defying gravity and nature. So God bless. I need to get whatever you're having for breakfast. But in all seriousness, the upper eyelid skin as it comes down over the upper eyelids can potentially impact not only the way you look, but the way you see. And if you are, or any individual out there is noticing that they're having such a problem, they should consider seeing an eye doctor. And if they note that their visual fields or the area of where they're looking is being obstructed to some extent by that upper eyelid skin, sometimes insurance can help out for the upper
Adam,
eyelid.
I love that. So what you're saying is, if you have trouble breathing, you can get insurance possibly to cover your nose job. If you have trouble seeing, I guess anybody could say they have a little bit of visual field issues, then you can have surgery cover the eye surgery.
I wish it were that simple, but as everybody knows, insurance companies are not in the business of paying for cosmetic surgery, and so it's not that they're going to pay for the cosmetic surgery, but if there's a functional reason that can be documented, not just saying that, I can't see that area, but it actually has to be documented by an eye doctor.
Let me ask you this. Are men coming in for enlargement of their phallus?
There are in certain cases. It's not a procedure that I specialize in. There are doctors who do that. I'm not going to say that it's a very common thing, but there are people who absolutely want to see either more width, more girth, more length, and there are ways to address that.
Yeah, it sounds good. Well, I just want everybody listening to understand. I want people to know. I want you to know that you cannot increase the length of your phallus, and in fact, a lot of times plastic surgery-wise, we'll cut that suspensory ligament so it'll hang differently, but it certainly will not increase the overall length, and we don't recommend any sort of plastic surgery on the phallus, just for cosmetic purposes, such as lengthening or increasing the girth. Of course, some people have curvature of the penis, and that's sometimes called Peyronie's disease. We could take care of that as well. I got to tell you, Adam, it's fascinating to have you on the show here. Just give us your website again.
Absolutely. www.drschaffner, DRSCHAFFNER.com, or call 212-688-6600.
Oh, Adam, thank you very much. Appreciate it. Dr. Adam Schaffner, plastic surgery to men and women as well. Everybody's listening. Thank you very much.